So glaucoma is a common disease where the peripheral vision is gradually lost and the patient can end up with tunnel vision or eventually no vision at all. So we've used a technique called genome-wide association studies, and by recruiting a large number of patients who have a given disease, we can then compare their genetic signals against the normal population, and that enables us to identify individual genetic variants, and then accumulating all of those genetic variants into a polygenic risk score enables us to put every single person on a continuum of risk. So it's the process of amalgamating all the genetic discoveries that we've made into a single genetic risk score that is the breakthrough that enables us to translate that into clinical practice. If we look at how medicine has always been done, you can be an outstanding clinician and apply the same treatments but apply them very well, but really nothing is going to then improve. So you do need to have clinicians and scientists working together to find better ways to solve problems. And so this building here is about putting clinicians and scientists together to actually identify what questions need to be answered. And in our case, it was the ability to predict who would develop severe glaucoma, and then to be able to find ways to change the way that we look after those people. We're very fortunate to have been able to move our laboratories into a unified space, Flinders Health and Medical Research Institute. And within this facility, we're able to store and work on all the DNA samples from our glaucoma registry project. So in the hospital, we recruit DNA and blood and saliva from patients with disease, and then we move over to the laboratories here where DNA is extracted, stored, and then we can conduct the genetic testing that actually identifies new genes for glaucoma. So we are doing better. And you think sometimes, it's disappointing when patients still have vision that isn't as good as they want it to be. But then we have people come here from overseas and they can't believe the patients don't go blind. So they look at our clinic and go, wow, that's amazing how well you do. And we're looking at it going, we want to do better.